Mrs. S. is a retired teacher who is 84 years old. Her partner died 5 years ago, and she moved into a retirement home after suffering from a prolonged period of depression. She's been living in the home for 2 years. Mrs. S. has mild hearing loss, osteoporosis, and a history of constipation. However, none of her conditions have stopped her from enjoying life. Mrs. S. is a very social person who loves delivering the mail to the retirement home residents. Mrs. S. spends much of her time with her best friend, Mrs. B., who shares many of her interests and has grown to be a great confidant. She enjoys reading to those with vision problems and plays the piano for sing-songs. As an active gardener, she takes care of all the plants in the residence, something she is particularly talented at. Recently, Mrs. S. suffered a fall when she slipped on some water that she spilled on the floor. Unfortunately, her fall resulted in a fractured pelvis. Mrs. S. was treated in an acute care unit and is now awaiting rehabilitation. When the other residents heard Mrs. S. had fallen and was in the hospital, they all asked to visit her. But when the first visitor, Mrs. B., arrived, Mrs. S. seemed very disinterested and didn't have much to say. After a few minutes, she turned away from Mrs. B. and went to sleep. When Mrs. B. left, she mentioned to the nurse that her friend was not herself. When the nurse entered Mrs. S.'s room, he noticed a lack of responsiveness. Mrs. S.'s meal tray was untouched, she had a furrowed brow, and was moaning softly. When she was asked to do some small range of motion exercises, the nurse noticed her movements were very delayed and slowed compared to the day before. It was evident that Mrs. S. wasn't herself. The nurse assessed her orientation and found that she was oriented to name only. Her heart rate was elevated above her baseline. He called the physician right away and expressed his concerns about delirium.